Hello, I'm Stephanie Knutson, and today I'm going to talk about narcissistic personality disorder. Um, on the left is a little cartoon that kind of sums it up in a nutshell. The character on the right thinks that he is more important or most important than other people. All right, so as defined in the DSM-5, narcissistic personality disorder, or some people use NPD to shorten it, is a pattern of grandiosity, need for admiration, and lack of empathy. So some of the main symptoms are an excessive need for admiration, disregard for others' feelings, an inability to handle any criticism, and a sense of entitlement. They routinely overestimate their abilities and inflate their accomplishments, often appearing boastful and pretentious. So, to be diagnosed with narcissistic personality disorder, according to the DSM 5, you need to have at least 5 of these symptoms, beginning by early adulthood and present in a variety of contexts. Some of those added to what I stated earlier are an inability to empathize. Some people with narcissistic personality disorder will pretend to empathize in order to kind of manipulate in order to get their way. So another one is manipulates, blames, and gaslights, always thinks they're right, grandiosity, an excessive need for praise and admiration, displays a sense of entitlement, believes they are unique and special, etc. So also what's important to note, that underneath their seemingly confident exterior, individuals with NPD often experience deep-seated feelings of insecurity, vulnerability, and shame. They may have fragile self-esteem, which is easily threatened by criticism or perceived slights. In response, they may react with anger, aggression, or defensiveness. Okay, so the etiology of narcissistic personality disorder is pretty multifaceted. Some studies have suggested a genetic predisposition toward the disorder. Traits such as aggression, reduced tolerance to distress, and dysfunctional affect regulation is prominent in persons with NPD. Developmental experiences, negative in nature, being rejected as a child, and a fragile ego during early childhood may have contributed to the occurrence of NPD in adulthood. In contrast, excessive praise, including the belief that a child may have extraordinary abilities, may also lead to NPD. So we're looking at kind of the extremes on, neglect from childhood to excessive praise. Both of those extremes can lead to NPD. So it can be broken down into 3 concepts. One is overt narcissism, which is the stereotypical narcissism, which is loud and grandiose. The second is covert narcissism, which is more fragile, self-effacing, and overly aware of others. And the third is malignant narcissism, which is a combination of NPD and antisocial personality disorder. So according to the DSM-5, in their community samples, they saw a range from 0% to 6.2% prevalence, approximately 0.5%, or 1 in 200 people in the United States alone. Of those diagnosed, 50% to 75% are men. Okay, so differential diagnosis. So it can be easy to confuse NPD with other disorders because grandiosity may emerge as part of manic or hypermanic episodes. Also, it needs to be distinguished from symptoms that may develop in association with persistent substance abuse. The most useful features in discriminating NPD from histrionic, antisocial, and borderline personality disorders, in which the interactive styles are coquettish, callous, and needy, respectively, is the grandiosity characteristic of NPD. That being said, if other personality disorders are coming up, they can also be diagnosed in addition to NPD. So someone can have anxiety disorder, manic depressive disorders, etc., along with NPD. So the treatment for this is a little bit tricky, but definitely possible. Why it's tricky is that telling someone with NPD that they're doing something that's harming other people or something wrong, they'll perceive that as criticism. And again, people with NPD have a real hard time accepting any sort of criticism at all. So some of the approaches towards this is a long-term, consistent outpatient care. So this usually involves a combination of psychotherapy and medication management. The mainstay of treatment is individual psychotherapy, specifically psychoanalytic psychotherapy. Other therapeutic modalities used to treat the disorder include group, family, and couples therapy, as well as CBT and short-term objective-focused psychotherapy like Gestalt therapy and mentalization therapy. So those are a few. I think that sums it up pretty much. In conclusion, narcissistic personality disorder presents as a complex interplay of grandiosity, a constant need for admiration, a lack of empathy, and feelings of entitlement. While individuals with NPD may exhibit outward confidence, it is important to recognize the underlying insecurities and vulnerabilities that contribute to their behavior. By understanding the clinical presentation of NPD, we can promote empathy, compassion, and more effective strategies for supporting individuals with this challenging disorder. Thank you.